Hello, everyone. Today we are discussing snake bites, and I would want us to treat all snakes as poisonous snakes, though we have some snakes that are not poisonous. So, poisonous snakes like the black mamba, the vipers, the king cobras, they have this, very strong poison that once they get into your system, they destabilize your whole system and cause different kind of manifestation. And the non-poisonous one, example of them, we have the green snake, we have the corn snake, and we have the mink snake. This type of snakes, and we have so many others. Once you get bitten or anyone gets bitten by this type of snakes, they really do not exhibit any serious or any symptom at all, rather than the effect of the the force you know that is exerted on the beating area. So quickly, let's talk about the first aid management of snake bites. So generally, we need to ensure that we limit movements of the body affected. So this would actually help to reduce the rate at which blood flows to the body. And once you reduce that, you confine the poison to only the affected area. By doing so, you are avoiding further severe action, you know especially that is caused by the venom, the poisonous venom. So the first thing you also need to do is to ensure safety before anything, because you need to save yourself from any further attack or the victim also, and call for help. While doing so, place the patient in a comfortable position, most likely the you know right side of the body. That's the recovery position. So if the patient is bringing out anything from the mouth, you can easily bring it out without choking. And you need to ensure that you release the tight clothing, maybe on the neck or the leg or any affected area, just to ensure that this patient is able to breathe well. And the tight area, you need to ensure that you don't use tourniquet on this affected area above or below. You don't use tourniquet, because tourniquet would actually cease completely the blood flow and might even cause further harm for the patient. But what we use there is a soft pad that you can use. You can use other kind of soft tissue to apply some pressure just to be above and beneath the affected area, with ensuring that the pressure is not so tight enough to cause complete total blood flow. And this tying must actually be released within 15 minutes, not more than 15 minutes of the being tied. So anything you need to do, you need to ensure that the patient is taken to the hospital within that period of time to avoid any further injury to the body and further treatment to be given. Then next is you need to also ensure that you call for medical attention while doing everything, and you treat the patient symptomatically. What we mean by treat symptomatically is whatever the condition, whatever the presentation is, you treat according to the patient's presentation. And I told us earlier of application of splints. You need to apply splint to ensure that the patient doesn't move so much. The body is restricted to a particular place to avoid this venom from traveling to different parts of the body. So, and once this patient is taken to the hospital, what they will need to ensure is to ensure that there is a continuous circulation of blood, and also continuous pulse, continuous respiration. So these are the things they will check in the hospital. They might want to administer, you know, oxygen. They might also, the first thing they would also want to consider is to give the antivenom. So if there is an antivenom around, the general antivenom, you can actually give the antivenom. Well, in some cases, they would want to see, maybe know the type of snakes or the type of snake that this person got exposed to, because in more civilized world, there is a specific venom for all type of snakes have their venom. So however, in this part of the world, we just need to ensure that the snakes are taken as the same, and there is a general venom that is being given. So this venom would help to reduce any severe side effect. Then if you can also, you can actually get the blood sample of this patient. There is what we call some coagulation test. It's a very simple procedure. You get the blood in a very plain glass, without water, without any fluid or anything, a very neat cup or glass, put the blood there. If the blood doesn't settle or get coagulated immediately or almost immediately after transfer, it shows that this blood, is actually affected by the venom. When you see a blood, immediately when you get an injury, the first thing that happens is that the blood clots immediately. So if this blood is just there like water, and when you turn it to another container, it's just like water, like zobo, without turning to, a thick, without clotting or turning into a thick blood, it shows that this blood has been exposed to, venom. That is, the snake is venomous. And if this patient starts, reacting, developing different kind of, feelings like headache, like feeling like to vomit, like, feeling, having confusion, and so many other type of symptoms, you should know that this snake is also venomous. So in every snake bite, you have to quickly treat as venomous, and, as much as possible, transfer this patient to the hospital for further and complete treatment by multidisciplinary um, by multidisciplinary